So, well, I just would like to thank the organizers for inviting me to speak today. And I think I stumbled into the field of digital pathology and AI really driven by fear, because all of a sudden, maybe in 2020, started hearing about digital pathology and AI solutions in pathology, and then you start thinking, I started thinking, oh, are we going to be replaced in the future? Yes or no? And that's how I wanted to educate myself and get involved and in a way be on top of the field rather than just be unaware and unable to plan for the future. So I've been a consultant for 6 years, so I'm relatively early career, and I think then most of my career will be impacted by all the changes we're seeing nowadays. And really, this presentation is my attempt to understand how the future looks like based on the research of experts and what evidence we have so far on how the future would look like. So I think it's a topic close to heart. And when I started looking at this topic, I wanted to explore how did digital pathology evolve and how AI came to be a thing in the sphere of pathology. And it seems that the earliest digital solutions or artificial intelligence solutions started in the 1960s with sort of diagnostic aids to clinicians based on symptoms and signs and what would the differentials be based on those clinical features. And then obviously there was the digital white whole slide imaging that was going on in the 90s and the early 2000s. And I suppose between 2010, 2019, there was a leap in the AI and computational pathology and the convolutional neural networks, and that enabled the technology to evolve further. And by 2024, between 2020 and 2024, there was regulatory clearance for a lot of pathology solutions. And now in 2025, we're looking at multimodal and agentic solutions, as well as regulatory approvals and acceleration of the technology as part of the national policy. So I think everything is accelerating quite quickly at the moment, that we might not be able to predict how the future would look like in terms of the technology. But we have been hearing all day about the drivers of why this technology seemed to fit the need in the healthcare, because we're struggling with workforce, we have increasing demands, and possibly there will be increased diagnostic demand in the future with the aging population and screening programs and the increased incidence of cancer. There's also current difficulties in meeting turnaround times. We have a horrible waiting list that is growing every year, and there are patient safety concerns. And I think a main accelerator was COVID-19, because it really exposed the health system and how vulnerable we are and how we have to start scaling to meet all these demands. So in the recent Royal College of Pathologists Workforce Strategy, which was published earlier this year, there are three main pillars, which is train, retain, and reform. And reform really is about adopting new ways of working in the current workplace, and that is endorsing the use of artificial intelligence and digital pathology. Additionally, the 10-year healthcare plan has three main shifts, which we've all been hearing about as well all day. And the shift from analog to digital and sickness to prevention is particularly relevant. And in that document, there's a sentence that says, make AI every nurse's and doctor's trusted assistant. So over the next 3 years, all education will have to be overhauled so that we can prepare the workforce for a digital future. So to us as pathologists, it really looks like this image. We're sitting around minding our own business, and suddenly we're surrounded by digital technology and AI from we don't know where, and we don't know how to cope with that. And apparently, why we need to adopt this is because we have urgent pressing needs that we are unable to deal with the current workforce and with the current pipelines. And so it's imperative that we cooperate. And this is the pathway ahead, which includes acceleration and efficiency in the workflow, workflow optimization, more personalized care, and possibly more collaboration with artificial intelligence. So the main purpose is help the pathologists do their job more efficiently, more accurately, and probably allow more exploration and more avenues of science. So as we embark on this, it's important. I think this phrase is very important. So Yuval Harari is a historian who's been interested in the evolution of human history since the Stone Age. He's particularly interested in AI and the future that is we're stepping into with the AI evolution. And so he says it's very dangerous to invest too much in developing AI and too little in developing the human consciousness. And the sophisticated artificial intelligence could end up ruling over humans if we lack the wisdom to manage it. So as we are adopting AI into the workflow, we have to understand how to manage it and how to rule it. So interestingly, I asked one of the AI applications to write me a job plan for a histopathologist in an AI embedded lab, and that was the outcome. That he would, as usual functions, we would be reporting, teaching, and managing, but also would act as AI supervisors. We have to lead multimodal case integration, and the service design and optimization has to use digital platforms. And the education and training will involve AI literacy and safe human in the loop practice. Additionally, the key responsibilities would be oversight of AI use and participation in governance of AI. So in essence, there will be a lot of roles associated with AI as we step into this future. And so probably we're facing a shifting professional identity of the pathologist. In a report by McKinsey that was published in 2020, trying to predict how the workforce will change in the future, they predict that there will be less demand for admin, improved speed and accuracy of diagnosis, and easier access to more knowledge, which is all favorable. However, the skills that we will need to acquire as a workforce to be on top of that would be critical AI evaluation, understanding algorithm limitation and failure, data governance, and bias recognition, how to understand change management and workflow integration. We've been hearing about all the problems multiple departments faced with changes just adopting digital pathology. So how about AI? I think it will be even more complicated. And there should be interdisciplinary collaboration where IT, informatics, and data science can come together as a team with the doctors and the biomedical scientists so that we can create a harmonious workplace. And obviously, we have to be aware of the ethical and regulatory frameworks for AI deployment. Again, in that report by McKinsey, when they are highlighting the skill changes, it seems they're trying to list all the skills and a number of hours spent in 2017 as a benchmark and the predicted number of hours spent per skill in 2030. And it seems there will be a 124% increase in the digital skill use, and also a great percentage of increase in teaching hours, which also gives you an indication that possibly they're predicting that we will have more free time to give to education and teaching rather than just reporting. So in a way, we are facing a situation where there is a need for upskilling and continuous reskilling of pathologists to adapt to the changing environment. And in reality, it will always have to be a balancing act between AI supervision and then handling the leftover complex cases that require more human insight. And we need to be able to step into a place where we have more time for teaching and research, because that's where the potential of AI really flourishes, and also be able to manage the complex data that will probably come out of the AI workflow. So in order to do this, there has to be a framework for sustainable upskilling because, again, as I mentioned, the technology is shifting quickly. And what we know today of the applications, what we're prepared for today might change quickly in the span of 2-3 years. So the framework is essential. So we have to have the infrastructure and resources where adequate IT and informatics team are present to support pathologists and all the skilled staff that need to increase their skills as adoption progresses. That we have to have change management essentials where pathologists are involved in decisions from day one so that they don't feel they're left out of the process and they don't want to engage with the adoption. Additionally, we have to expect that there will be a slow increase in efficiency as we start the process. You don't expect to embed the AI solutions and all of a sudden we're very productive, we're very efficient, because it will take time until we're really comfortable with the systems and we have had time to troubleshoot everything and know how to work efficiently. Also, there has to be a restructuring of the team where it's suggested that it will be favorable to have multidisciplinary AI teams that can manage the deployment, the testing, the validation, and provide insight to all team members in the department. This report is really it was published last year and it's relevant to digital pathology adoption, but 2 points still remain relevant. If we don't have solutions to the cultural resistance to change, it will still be a problem to deploy AI solutions. Pathologists don't want to change because why change a system that's already working? And we're already very stretched and we don't have the time or the headspace to learn about new technologies or to validate for new technologies. Why should I be interested to do this? So if there is a cultural resistance and pathologists are not involved in the process from the beginning, it will be, in a way, an investment that's misplaced, because if your end users are resistant, then what's the point of the whole change? So they have to be involved from day one. Additionally, if the system is not working in its current situation, it will not work when you adopt it for AI. The whole system has to be restructured. And I think the report highlights that it's not worth it automating a bad process. If the process is bad, you just don't automate it. You have to restructure it. Additionally, the team members expected to be present frequently in pathology departments will not just include biomedical scientists and doctors and lab personnel. There would be digital people as well, people who design the AI, data scientists, people who build the AI applications, the AI engineers, people who oversee how we handle the data and how we use it for our AI applications. And all of these would be overseen by a chief AI officer. And I think we've heard a lot of talks today from MPIC, and I think they have an infrastructure where there's a lot of subspecialization in everything, that if they want to start scaling that for AI in clinical use, they will have all the relevant skills needed. I think every department would have to have a similar model if we want to succeed. And lastly, you don't just measure success of deployment by increased efficiency. You have to measure it by staff satisfaction, because one of the problems we're facing now is that staff are burnt out, they are retiring early, they're moving on or shifting from NHS to other sectors because they don't want to keep working in this very grinding, busy environment. So one of your metrics for success is that there's good staff retention, job satisfaction, and there's a very minimal burnout in your staff. Now, I'll just going back to that list of skills that is necessary, I think it's worth paying closer attention to the ethical and regulatory frameworks that will be needed for AI deployment. Last year, the European Union AI Act was published, and this paper is an attempt to adapt the definitions present within that act to the histopathology labs. So this is an act that governs the AI functioning in the general sense, not just in the medical applications. And this, according to the Act, they classify the AI applications into low risk, intermediate risk, high risk, and unacceptable risk. Medical applications are in the high risk category. Now, what this paper is trying to do is to sort of draw the specific responsibilities of the providers, who are the AI developers, engineers, and so on, and the deployer obligations, who are the end users of that application. So provider obligations include providing AI literacy, drawing the SOPs of how to operate the system, the possible fallouts of the system and how to handle them, and to continue to cooperate with conformity assessments after deployment. In terms of the deployers or the end users, they also have to educate themselves about AI. They have to ensure human oversight. They have to say that they are operating in a hybrid environment, or the pathology diagnosis was produced with aid of AI. There has to be transparency. And obviously, there has to be proper governance of the system. In the UK, the MHRA have commissioned a panel to start accelerating the use of AI in the NHS. And this is just published last September. And obviously, they're trying to align the objectives to the 10-year NHS health plan, but also it's trying to help by providing regulatory clarity on various AI tools for radiology and pathology. So I think there will be more clarity in that area locally within the UK in the coming months or years, and I think it's a space to watch for. But I think also this is very important, because if pathologists don't feel they are protected legally and they don't know the boundaries of where the responsibility ends and where does the responsibility fall on the AI developers and deployers, they would be discouraged to use the system, because then why put myself at risk when I can't control everything? So there has to be a clear framework. Otherwise, again, that will stifle adoption. This paper is trying to express that there are guiding principles to the use of AI, such as transparency, equity, and accountability, but there are so many cogs through which these principles will have to be applied that possibly towards the end, the responsibility is lost. Who bears the responsibility for the decision? So in essence, we have to redesign our governance frameworks in the workplace. Right now in the NHS, we are overseen by UCAS, but then we just set up some quality assurance measures, some quality control measures, and we are the ones overseeing everything. We and the lab staff, we are the ones overseeing everything, responsible for everything. If the machine malfunctions, it's our responsibility to tell the vendors that we need maintenance. It's our responsibility to make sure everything is maintained within the right time frame. But I think in the future, there has to be some shared responsibility between the healthcare users, the AI deployers, and the health technology sector. And I think in the end, there will be areas that would continue to be a shared responsibility between everyone. I'm not sure if the pointer's working. So that central area, the white circle, is where we'll find areas that we don't really know who is responsible for the mistake if it happens, because there will be a lot of intersections. So I think unless robust clarity and rigid regulations are there, that could be a very, very big factor in adopting AI for clinical use. Also, we know that agentic AI is coming up, and agentic AI literally draw conclusions without us overseeing the whole process. They just give you the conclusion. It's up to you to accept it or reject it. So again, there could be some blind spots with that. And if dangerous decisions are made, you can't really trace where the mistake goes. So there's a lot with the evolving technology. There's a lot that we cannot predict and we don't know how to deal with yet. But I think there has to be general, detailed frameworks for where the pathologist's responsibility ends and it becomes the responsibility of someone else. Right. So moving on from that, we have the risk of de-skilling. So if the workforce is heavily reliant on AI, can we lose our skills as pathologists? So increasingly diverting the workflow from pathologists to AI could lead to complacency, could lead to automation bias where I'm inclined to accept anything the AI tells me, could lead to omission bias where I'm not thinking about anything the AI is not suggesting. Potentially, clinicians might lose trust in any report we produce that is not overseen by AI as well, which is devaluation of human judgment. If that happens, we would lose autonomy. We won't be able to wean off AI if necessary. I mean, technical glitches can happen, servers can drop, electricity can go off, and then would we stop working? We have to still be able to use microscopes for conventional diagnosis. And ultimately, that would lead to our inability to oversee the AI operations, which is the heart of deploying AI and safely applying AI in the healthcare context. And I've seen this on the internet and I found it relevant. It was obviously a joke, but your future doctor is using ChatGPT to pass med school, so you better start eating healthy, which means public might lose trust if we are not really robust enough in how we apply AI and how we govern it. And I think this paper really discusses the behavioral impact of AI reliance in diagnostics very well. It's a very good read. And it highlights that although we have positive impacts, mental impacts, that we are confident in our diagnosis, there is a reduced cognitive load when diagnosing routine stuff. And there's educational reinforcement because, again, if AI is suggesting reasonable things that we can use, we are also learning as we're reporting. And there's enhanced decision making, but over reliance could lead to skill erosion, diagnostic deskilling, bias reinforcement, and then disengagement from the whole process. So it's a very delicate balance to strike. And this article, which is generally discussing how AI is affecting the cognitive functions, memory, and recall of humans, also is very interesting. And in that article, it tries to sort of go back and see how we learn and how we recall and how we develop skill. And interestingly, it says that skill is developed through a stepwise progression. So you have to learn first, try to do something before on your own, before asking AI to help you draft anything. That way you have learned how to do it, and then you learn from AI, it augments your learning. But if you're just diverting everything to AI, you just don't learn, you don't gain any skills. Additionally, using technology as a complement should be the sentiment in every workplace. Otherwise, we will be facing cognitive decline as humanity if as AI becomes more and more mainstream. So how to tackle this and stop this from happening? Well, it starts with how we develop the AI. You have to maintain human in the loop model. You don't allow AI to take autonomous decisions. It has to be, I'm pointing out certain areas and you have to make the decision. Avoid click to accept workflows, maybe provide justification why you're accepting this as an adenocarcinoma rather than an adenoma. Maybe it's not applicable for everything, but could be a possible solution. Again, configure systems to show the case first. So you would make your own independent diagnosis and AI would be like a second opinion, could be a workable solutions. And then periodic AI off audits where you're reporting without AI assistance just to maintain the skill and to sharpen your skill again. And probably again, planned annual microscope hours would help because then we have to keep our skills sharp with microscopes in case we cannot rely on technology for any unforeseeable reason. Also, once you've put that framework to protect against deskilling, you have to monitor that it's not happening and early intervention would be necessary. So you have to track reliance on AI in routine cases, monitor discrepancy rates when AI is not available, assess self-reported confidence in core skills, and obviously you have to adjust training and case mix for upcoming generations. So this will be a proactive approach to stop this from happening and intervene early. So the solution is really design of the AI solutions has to be by intention to preserve the integrity of the workforce skill. Now, having discussed all the previous points, there is eventually a risk of de-thrilling because as pathologists already working in pathology, we have certain ways that we're used to in doing the job. So if I'm no longer the authority in diagnosis and AI can diagnose, if I have to have an increasingly complex workload, if I have to juggle all these AI oversight, legal issues, governance issues, maybe then I'm not happy in the job anymore. Maybe it's not for me anymore. So that risk has to be mitigated. And it's really, really a very delicate balance between the benefits that AI can bring and the losses that we can have in our workforce. And I think the only solution to this is a culture shift where there has to be some benefits to the pathologist and some reassurances that this is the way forward and it's a safe way forward. So first, flexible working models is a great incentive because then there's something for me that I'm gaining as a pathologist by adopting this technology. Secondly, there has to be a reasonable capacity loading. So you don't fill my time with all the leftover complex cases and expect me to be happy because then I'll be mentally loaded. So there has to be some balance where teaching time, research time would be protected now that we are efficient and quick and I can do more jobs other than just reporting complex cases. And if any threats are there, like technology could replace people, all of these rumors. I mean, right now in my hospital, we're hearing rumors from management that, okay, pathology will be automated in the future. We won't need pathologists. And you won't believe that you're hearing this from management. So these sentiments should not be common because otherwise people will be discouraged to adopt the technology. And obviously, then you have to create career pathways that will make people think that using AI is a career enhancement, not a threat, such as AI management, AI research, AI supervisors. This way, people will think it's a progression rather than a threat. And talking about that and the incentives you can give pathologists, this is an interesting insight. So that's an article from last year. Bernie Sanders from America was proposing that with AI and automation, people become more efficient and they don't have to work as much. So possibly the work week could be 32 hours rather than 40, which again could be an incentive for people to adopt the technology. Now, this was actually a piece in Sky News last month, and it says that the AI is progressing so quickly that it feels like we've gone from the first airplane flight to something like a Concorde in 7-year period. And I think we can all agree with that. It's just booming everywhere. We don't know if you stop reading about AI for 2-3 months, you're just missing out on so much. So how to prepare the generation of the future for such massive changes? I think there will be role evolution from just diagnosticians to an integrator of all data. You're just integrating pathological data with genomics, radiology, clinical data. So it's about how you can act as a vector to make sense of all the data and convey that to your clinicians in a way that is, okay, that's the risk, that's the prognosis, that's the predictive data we have from everything that we've seen. So the generation of the future may have to understand that pathology is not just about morphological diagnosis, but rather understanding all aspects related to the disease very well and how you integrate that and communicate that to your clinicians. Additionally, there has to be an understanding that in the future, pathologists would need to work within multidisciplinary AI teams who can oversee, test, validate, and govern the AI. And that exposure to digital pathology and AI governance leadership might be part of the training. So the formal competency frameworks will have to change. There has to be a competency framework for using AI in diagnostic pathology practice, and it will not be optional. It will have to be a compulsory framework for every trainee coming out of the pathology program in the future. Additionally, if people are interested, they would be given the choice whether they want to just take the foundation AI competency program or just advance into intermediate and advanced training program for AI. And obviously, beyond being a traditional pathologist, you can be a computational pathology specialist or a digital transformation lead or an AI validator and quality expert. So these would all be ways to branch out as a trainee in the coming AI age. Obviously, for training, digital pathology and AI can provide a lot of opportunities because then it would allow access to a lot of slide repositories. There would be a lot of opportunities for self-guided learning. Remote training opportunities would be possible. You don't have to go to that specialist hospital and travel to distant geographical spaces when you can learn remotely, even as a remote fellowship with that hospital. And there will be feasibility of didactic sessions because in theory, we should have more time for teaching. It would be easier to retrieve slides and it would be easier to create presentations. However, as we're training the future generation, we have to look out for protecting autonomy. Trainees, I think, should not be exposed to AI early on in their training. They have to learn how to formulate their own diagnosis, how to reach a diagnosis using traditional ancillary techniques, and then maybe later in their training they can be exposed to AI. Or the other option would be they will produce their diagnosis as a first read, and AI would just be the second read to sort of fortify that diagnosis, but they have to learn how to work on their own. Additionally, if exams are not going to include AI, then you cannot train the future generation in an AI-rich environment because then they can't pass their exams. So we have to align the training environment to how exams are conducted. Obviously, with AI, there will be more and more opportunities for flexible digital and AI, not just AI. There will be a lot of opportunities for flexible and remote working, and we have to just set the limit. My time is off. Right, I'll just try to wrap up quickly. So we have to limit the number of days that people can work remotely. Otherwise, we're risking the tacit and implicit learning skills that people can have. And you cannot have inequality like AI-rich environments and AI-poor environments, and all the trainees will be differentially rotating across these two environments. There has to be equity in training. So final thoughts. I hope I have shown that it's not just about AI deployment and acceptance. There has to be systemic change in how we deploy and how we govern and in how we train the future generations. And I'll end with this, that this is a paper that discusses how AI technology should be driven by the objective rather than adopting whatever AI solutions that come across in the market. So if it's purposely built and adopted to fit a particular need, there should not be any risks for the future. Otherwise, we might be risking erosion of skill and workforce. Thank you.